Everybody, we've
That's
got
right,
a
it is
couple
still
of people
morning.
still trying to
Get,
grab some food.
cool. Yeah, if you provide food, they come, don't
Of
they?
course, of course. That's always the intention.
Yes, ma'am.
So, okay. So, good morning again. Good morning, good morning. I'm so glad that you all are here and took the time to spend some time with us. I'm Betty Dennis. I'm Dr. Dennis, and I am the Director of Diversity, Equity, and Inclusion for the college, and I'm also one of the master faculty in the School of Interdisciplinary Health Programs. Today, you all have, some of you have been coming for a long time. We have a lunch and learn series. And so every third Wednesday of the month, we will have someone coming to talk with us. Now, it changes a little bit on next month. Next month, we will have the Burien Lecture on March 21st. That's an evening program. It's free. You all are welcome to attend. And on March 22nd, we'll have our DEI conference. Our guest lecturer for both events is Dr. James Jackson, who has authored the book, Clearing the Fog. So I hope to see you there next month as well. Today, we are privileged and honored to bring back one of our alums. This is Morgan's, if I had two hands up. Yeah, Morgan,
Broncos!
exactly. Morgan is a graduate from the College of Health and Human Services, graduating in 2005 from the gerontology program. She even had some classes in our blindness and low vision studies program. So I'm very excited to have her back. She has authored this book that she's brought with her and is for sale, so you can talk with her afterward, called Carpenter Road. She will, in talking about trauma today, she's going to share her very personal story that comes from this book, comes from her life, and also then talk about trauma and its impact on health. So I'm going to give the floor over to Morgan. There is information on the table. There's two parts to it. So next to the water, take 2 sheets of paper and feel free to be engaged and ask questions. I guess I can turn this off because you don't need the computer.
No, yep. Is it this power button?
Yep. So please give a warm welcome to Morgan State.
Thank you. Thank you. I really appreciate being here. I'm very excited about it because I love Broncos. In fact, after I graduated, I went out and got a whole bunch of horses because I needed to have the Broncos in my life. So part of my life is dealing with that. But I loved Western. And after I graduated, I landed a smoking cool job at Heritage Community of Kalamazoo. And I was instrumental in starting their whole entire education program for the staff. So I taught staff how to care for the elderly properly. And so I did that for about 8 years. But unfortunately, as you will learn in my story, I ended up having to leave very abruptly, leave Kalamazoo and take off because my perpetrator was being released from prison, and they would not assure me that they could keep him out of the area where I was living. And so we ended up leaving, and then they decided to go back on the word about keeping him out of where we were moving to, and just said, no, we can't do that. He's going to be in your same community. And we had already quit our jobs, started to move, put our house up for sale, and I'm like, how's that? What are you talking about? And so we had a big, huge fight with the Department of Corrections, and in the end, with enough publicity that you can look online and read about, they finally got pressured enough that they put him on an airplane and sent him down to South Carolina, where he has since passed. And so I left Kalamazoo, and boy, I wish I was still here. I have a 15-year-old. I would have loved to have had the promise and taken advantage of that, just because the opportunities in Kalamazoo are wonderful compared to where I ended up moving back to where I grew up, which is a very, very small town in like the outskirts of Flint, so about 2 hours from here. And so I miss Kalamazoo. I got off the highway yesterday, and I'm like, oh, I'm home. And then driving in here was kind of tearful. But I did graduate in 2005 with gerontology. I went into teaching, and then when we left, I basically now do caregiving for the elderly. So I have multiple clients, and I take care of, and I absolutely love it. I think older people are the greatest thing on this earth. So with that, that's kind of my background. And the entire time I was working, I was writing. I was writing my story because it is extreme. It is very, very bizarre. It's almost hard to believe. It's like this doesn't happen in this day and age where children are this victimized and traumatized, and it's just continuing and continuing and continuing, and no one's helping. I mean, besides wearing a huge sign on my face that I was being abused, I don't know how they couldn't recognize that, and how the teachers weren't recognizing that. My parents were not recognizing that because my mom experienced severe trauma, but she left it untreated, except for the fact that she treated it with alcohol. And so therein lies kind of my situation where I got set up to fall into the situation with what I'll explain with the abuser, because my mom was not on her game. She was out drinking and was not home until 2:30 in the morning, and then I could go days without seeing her. So it seems unfathomable that you could have a child being this victimized and you not recognize it, right? I mean, I don't know how many any of you have children, but it's like if your child came home and had been this abused the night before, how would you not see that? Unfortunately, I was like the perfect storm for this situation. And so I want to ask you guys a question, and only raise your hand if you're comfortable. But how many of you have experienced trauma? Okay, throw out some things that what trauma is. What is trauma? How does trauma show up? What forms of trauma are there? Abuse. Emotional. There's a whole bunch. Keep coming. Yep, an accident or victim of a crime. I mean, there's tons of trauma. Have any of you ever felt safe after a school shooting coming to campus? Has it made you nervous? Have you thought about it? Do you think about it? Well, we're kind of all being a little bit traumatized with what's happening just out in society. My partner said, hey, let's go to a club. I'm like, no, I am not going to a club. Why? I'm like, because people shoot those things. I mean, it's always in the back of your mind, and that is kind of, unsettling to us. But you can be in a car accident, you can be in the military. They consider like a contentious divorce for children. That's traumatizing to children. So how many of you have been traumatized? Yeah. Do you know how many Americans are considered to have had trauma? What percentage would you throw on that? 70%? Very good. Higher, lower, anybody? 30%? Anybody else, higher or lower? Okay, it's 90. It's 90. So it's like, if we go back through what trauma is, a lot of you more are probably going to raise your hand, because it really can be just about any experience that and it can be insidious, or it can be a one-time event. A carjacking can be a one-time event, but you could develop anxiety or post-traumatic every time you come across that intersection where you were taken out of your vehicle. That's trauma. It comes in all forms, and everybody deals with it differently, but trauma doesn't necessarily have to lead to PTSD. It doesn't have to lead to lifelong anxiety. It just depends on what it is. But mainly what I'm talking about today is the intense trauma that I experienced as a child and how that set me up for my entire life, and how healthcare played a good part in that or not so good part in that. I've had both experiences. There's 8 million people in this country that have post-traumatic stress. 8 million. That is a huge number. And 10% of that are women, and 4% of that are men. So just kind of keep that in mind, because if you're kind of dealing with healthcare and people coming in, I heard from this group here is OT. I got a little bit of nursing back there. Is there somebody else here from other departments?
Speech and language and family science.
Okay, speech and language. Anybody else?
Social work.
Oh, yay, social work's here. Yay. Okay, so again, there's a lot of us out there with trauma. Now, if you were to pass me in the hallway, do I look like I have been completely tortured as a child? No. I'm fairly well dressed. I got my hair combed. I'm not like staring into space. I don't look like I've been victimized to the point that it almost broke me. But here I am. And I go to OT, I go to physical therapy, I go to speech language, I go to doctor's appointments, I go to nursing, and all of these encounters are extremely stressful for me. You should see what it takes to get me to the dentist. It's not fun. And so the new thing right now, and that has been started in healthcare, is trauma-informed care. Are you guys familiar with trauma-informed care? Well, trauma-informed care practices need to be forefront and center of all of healthcare. We have to develop what trauma-informed care looks like. I have tried to find a new therapist for the last year that is trauma-informed therapy who can deal with what level of trauma I experienced. It was an hour and a half away. It was the closest somebody, a therapist, who was trauma-informed that knew how to work with my level of trauma. So we need to kind of kick it up a notch, because there's a lot of us out there with trauma. In fact, when you work with patients, just assume they've had trauma, because we're at 90%. Just assume that, and think about what that is for that person. Even in coming into OT, I had an injury. I've had multiple injuries, but trying to do either physical therapy or occupational therapy or speech language, it is so stressful to me that what you'll see is somebody who's either completely shut down when I get there, or I'm extremely emotional. And that can be either in the form of crying, it can be in the form of agitation, irritation, anger, all sorts of things. And you might think, what in the world is wrong with this person? But trauma-informed care asks, what's happened to you? What's happened to you? So every person that you come across in the future where you're working, you want to ask, what's happened to this person? What does their whole life story look like? Okay. And we know that statistics on females, 1 in 5 have been raped at some point in time, and 12% of that were persons under 10. Now, I've brought handouts, and does anybody have the handouts? I brought these handouts because this one book, The Body Keeps the Score, please read it. If you're going into healthcare, please read this book. It is profound in what trauma does to children and what trauma does to the brain. They are finding and they are studying so intensely on what trauma does to a person's brain. And if you're a child, it's even 1,000 times worse what happens to the brain. I mean, everything is being changed for that developing brain of a child. It's being almost destroyed. And so this book goes into that so very well. It's some clinical, but it's also a lot of stories where they give examples on how that's happening. So I'm just going to start off by telling you my story, and I apologize. It is graphic, it is difficult, and my book has hardly any of it in it. You'll read it, and you'll see and learn that I was abused, I was beaten, I was raped, but there's no torture in here. I left the torture out. That's going to be my second book, because what my story is my parents switched me to a new school, private Catholic school, in 3rd grade. And that was for my mother's convenience of scheduling, because she loved to drink and loved to drink outside of the home and was not there. I could go for days without seeing her, like I said. And when I switched schools, I met a new friend. I was shy. I was already afraid of adults. I was already well into PTSD and anxiety just from what was happening at home. And so when I met this girl, I thought, oh, thank God. And she was a little shy too, and a little quiet, and quite a bit reserved. So we hit it off very well. I started hanging out with her. I started riding my bike over to her house. And within a couple months, all of a sudden, her father is targeting me for abuse. And the first incident was just him grabbing me and hurting me and putting his hands in parts that I was like just shocked. I had no clue what was going on. But his methodology was fear right off the bat. I wasn't necessarily groomed into working up to this. It was, if you tell anybody that I just did this, I'm going to kill you. And I'm 8 years old and have no clue what's happening. I had no frame of reference. And so I did not go back over there, and my friend kept bugging me, please come back, please come back, please come back. I'm like, and she would not talk about what had happened. It was as if it didn't. And so I just could not figure it out. So I went back over there, played after school, everything was fine, and we kept progressing in that manner. And then she talked to me in the spin in the night, and boom, there he is again in the bedroom. And it's like, what is happening? And again, he said, you know, you tell anybody, I'm going to kill you. And why would you kill me? And when I would question him or try to resist, then it intensified with the physical. And so it just kind of kept going on in this manner until one day I wanted to leave and go home, and it was nighttime. I wanted out. It was winter. I wanted to leave. And he said, well, I'm going to take you home. And I said, oh, okay, I can walk. No, it's too dark. You're not going to walk. Let's go. And we started out the door, and he was behind me, and he put his foot on my back and just kicked me completely out into the garage, missed the steps, landed. He picked me back up off the floor like a rag doll and said, you ever tell, and I'm going to kill you. And then I might kill your parents. And then I might keep one of your sisters for myself. And I'm a little bit tenacious. I'm a little bit stubborn. I said, which one? So I did stuff like that to kind of make it worse, but I was like not going to give in to this insanity. And so, you know, then I had, you know, to deal with that. Every time I buffed back, I got the physical. And so this went on for a long time. It intensified. The more he had control over me, the worse it got. The more he ensured my returning. Like, why would you return to a house where you're being abused? I didn't live there. Why would you go back? And that is what my entire second book is about. Why did I keep returning over there? Well, I'm 8 and I believed him. I believed he would kill me or my parents or my family or whatnot. And he always seemed to know where I was. He always seemed to know like where, if I hadn't been over there for a certain time, I would get punished. And it just continued to escalate like that. Now, let's jump into the school aspect of it, which I really hope to talk to education. The Catholic school that I was in, the private Catholic school, they saw the change in my behavior. They saw the change in my personality. They really saw the change in my academic status. I came in with wonderful attendance, right on the mark for the levels I should be at for reading, and my grades were fine, and then within 8 to 10 months, I'm failing everything. And they just kept trying to promote me to the next grade and to the next grade. By the time I finished high school, I read at a 4th grade level. I couldn't even get into Western because I applied, and they're like, yeah, no. And so I really didn't have a lot of options. I couldn't read, I had no math skills, I had no skills of any kind. And so that's a whole different story on how I finally kind of overcame that. But yeah, I left school not even being able to read, and no one helped me, no one did anything. And it wasn't for a lack of trying. I did everything to get attention. My behavior went from, sweet old Morgan to the most terrorizing person. Every student in the class was afraid of me. You weren't safe on the bus. If you had anything that I felt like should go out the window, it went out the window. I was doing everything trying to get attention. And that continued to escalate too, because at one point I started writing horrible graffiti in places in the school that you shouldn't be writing horrible sexual graphic material, and it was still ignored. And so that is a huge part of my story, is just the neglect from the school. Once I reached 7th grade, they wouldn't give me textbooks. Like, well, you can't read them anyway, there's no point in handing them out to you. And I'm like, oh, okay. So a friend of mine and I devised a plan on how to cheat, because every time I did sport, they were going to hold me back. Well, that to me was paramount to just the worst thing in the world, because every teacher I had, I wanted it away from them. You're not going to keep me back. And they did promote me, but it was just to placate, move me on, get me out. And so that's a sad, really sad, disappointing part of the story, is that all of this could have been averted pretty early on if any of the teaching staff would have reported it. You're bound by law to report. It's pretty clear. If you don't want to do it yourself, you go to your hierarchy. And no one did. And then we had a new priest arrive. And lo and behold, he was super fun, super jolly, super nice, super cool, super sexually abusing all the boys. And so his part in the school of not reporting it was, we're not doing this, we're not reporting it. Nothing went past him as far as what the school could do. It all had to go through him, and nope. So it was just a shitstorm, and I was the perfect storm for this entire situation with my home life and then being at this school and on and on and on. I really don't feel like if I was at the public school that could have continued. I think they would have been much more aggressive with what was going on and reporting it. So when I finally got through school and I got through the private high school, they didn't have me in a lot of classes. They had me doing office work and so forth, because I couldn't even do algebra. I couldn't even go past that. I couldn't even do biology. And so they just kept trying to figure out what was wrong with me. And being at that school turned my situation around, because they were all over it. They were like, why are you walking like that? Why have you been here in 3 weeks and had 4 black eyes? Why? And so they started really aggressively trying to figure out what was wrong, how to help me. They knew my parents drank, so they assumed maybe it was coming from the house. At one point, I started drinking so badly at school that was a call home. Now, she needs to get some outside therapy, and they forced me into outside therapy, which probably saved my life. I was 16 at this point, and going into therapy, but not being able to say anything because of the laws were, if I told her what had happened, I was still under 18. It was getting reported. And I was terrified. That was probably the worst thing that could have happened, was my secret being found out. And I had to keep that secret. I had to keep quiet. I had to just keep my head down and do whatever I could to survive and not get turned in. Because being turned in was the most terrifying thing in the entire world. And so I sat there in therapy for 1.5 years till I turned 18, just sitting there. And then I finally started to reveal a little bit and a little bit. Obviously, the therapist knew I had been extremely traumatized just based on my behavior. But little by little, I started to open up. And little by little, I told. And I kept telling my story. I am 52, and I'm still divulging parts of my story that I have not yet to reveal to even my partner. That's how much shame I live with. That's how much embarrassment I live with. That's how much guilt I live with. And so I am a train wreck when I come into any of your services. And I'll give you a couple examples. It wasn't long ago I needed to go into an appointment for your general physical. And I try to do all these things, but coming into them is hell. The first thing you do is arrive at the desk, sign in, no problem. The nurse comes, or whoever the tech is, brings you back. Okay, stand on the scale. Let's go get your vitals. Well, taking my blood pressure, you're going to get a horrific reading. So I will try to say, I don't want my blood pressure taken. I know where it's at. I know it's good. Can we skip that? No, it's part of the physical. We have to have it documented. And I'm not one to really speak up for myself very well, so I let him do it. But to me, putting that cuff on me and inflating it is the same as him grabbing a hold of my arm and picking me up off the floor and relocating me to the closet. That's what getting my blood pressure is. Okay? So you have somebody coming in who's begging not to have their blood pressure taken, and the nurse is like, basically, sit your butt down, we're going to do it. I have to have it in the record because that's what the rules say. Okay, so then they leave, and I say, will you please leave the door open? No, that's against HIPAA, that's against privacy violation. I can't have you seeing other people, other clients, they need their privacy. And I'm like, well, could you just leave it open a little bit? Nope. So she leaves, and I open it because I don't like to be in a room with the door closed. And doctors are famous for bringing you in and sitting you in that room, and you could sit there for what, 15, 20, 30, 40? And the whole time, my stress and anxiety is just going through the roof. And then the doctor comes in and starts asking me all sorts of questions. And then you've got the questionnaire, well, how many sexual partners have you had? And I was, really? And I lie. Because the number, is it voluntary or involuntary? What number do you want? And I'm going to be ashamed and embarrassed to have to add 3 to that, because that's what ended up happening to me. And I'm ashamed of that. I'm embarrassed about that, so I lie about it. Well, right there, that skews my treatment, because the more information they have, the more they can help you. And if they have a full history, they know where to look at different things. They know where to test, where you might need this. And those forms that you fill out, how much alcohol do you drink? Do you do recreational drugs? What prescriptions are you on? Do you smoke marijuana? Well, how many of you are honest about some of that before some of this was legal? Let's just say pot was not legal years ago. How many of you answered that honestly? Don't raise your hand. I didn't. I started smoking pot when I was 12. That was the only way I could cope with it. How am I going to go through the night without some sort of numbingness? And so I left those questions blank, or I lied about it, or I wasn't honest. So you've got your patients coming in who are not giving you a true, thorough history because of trauma. And you kind of have to work your way up with a patient to build up the trust, to be able to get honest answers from them so you know what to look for or where to look. Or if I'm having a specific issue and she's quite puzzled because, well, I don't smoke, I don't drink, I don't do marijuana, but why is this, and this happening? Well, she's just sitting there scratching her head because I haven't been honest with all that information. And so trauma-informed care is trying to redo all of this. instead of having these horrible invasive questions either asked directly to you, we need to be a lot more sensitive on how we gather someone's history, especially if they've experienced trauma. Any questions, comments, anything? No? Okay. Yeah. Oh, yes, ma'am.
And I hope you don't mind
Nope,
this question.
it's probably in the book.
Did your friend know? Like, was she?
Yes. Yep. Yes, the whole family was. The whole family was involved, and the whole family was being abused. There was 3 boys, 3 girls. I don't think the boys were being sexually abused, but he beat one of the boys so badly that he was developmentally delayed and continually held back. He was beaten in the head so bad that he became cognitively impaired, and he ended up being extremely morbid or obese, which was very bizarre, which should have been another red flag because the entire family was skin and bones because they didn't have money to really properly feed the family. And then you've got this child who's just enormous. And it's like, what, so there were things that stood out for me and the entire family, and we all went to that school. And so, yes, the wife was beaten horrifically, kept her mouth shut, head down, and they all acted like it wasn't happening, or my friend would be almost perplexed by what I was trying to ask her. Like, why did your dad do that to me last night? Do what? So she was so traumatized by the time I even met her. Her level of dissociation, again, please read The Body Keeps the Score. It very, very much goes into what dissociation for people who are victims of trauma, what that does to the brain. She probably didn't know what I was talking about. She out everything. And I learned how to do that too. And so that's where I still struggle today, because I built up this enormous wall in my head. And when things were happening, I went to that wall, I got behind it in my head to that safe place, and I wasn't really aware of what he was doing to me once it continued to escalate and reach levels of, this is too much. I left, checked out, see ya. Couldn't make my body do it, I made my mind do it. And so right now, I'm still in very intensive therapy, breaking down that wall, because I can sit and tell you everything that happened. I might even laugh about it. It's because I'm completely separated from my emotions. And so when that happens, what that is also doing to the brain, I had no ability to learn, none. I'm sitting at school, I can't learn. I can't learn when I'm in that environment. I can't learn when I've blocked out everything. I can't learn when I don't remember the last 3 days. I can't sit in class and hear about social studies when all I can think about is what's happening, what's going to happen tonight. What's he going to do tonight? And so, yeah, the whole family was involved. Did you have a question?
I do have a question. I'm trying to understand what should, so you talked about trauma-informed care.
Mm-hmm.
What would be a better question that the doctor could ask you, even now,
Mm-hmm.
than what we normally go through? Because as
Mm-hmm.
you were describing it, I just did this the other day when I went to the doctor. And
Yeah.
it didn't seem like a big deal until you just said it.
Mm-hmm.
And so I'm wondering what would be a better way
Mm-hmm.
to help people?
Well, let's just take physicians for that, because that's probably most of what we're encountering as our physicals. You guys are young. You probably all haven't started your mammograms yet. My doctor has called me 14 times. You going to get this done? Oh yeah, you know what? I'll schedule it right now. 3 weeks later, have you got? Oh God, I forgot. I'll do it right now. Or going into a PAP. Yeah, that's really fun. And so, but if you go into like a general practitioner for your healthcare needs as a complete physical that we're supposed to have every year, the paperwork needs to be more sensitive. The paperwork needs to be worded in a way that you feel safe answering the questions. And trauma-informed care is, again, not, why are you like this? But what happened to you? If you sit down and calmly and safely and gently talk to me, I will answer your questions honestly. But if you come in with your computer and you sit down and you start clacking, because they all have these little things now, clack, 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 clack. Do you smoke? Clack, 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 clack. Do you drink? Clack, clack, clack. I mean, just firing questions one after another, and it's too much. It needs to slow down. She needs to get to know me as a human being and know what I went through. And so instead of just being so factual and so clinical, let's dial that down and be a human being to another human being. Because I've encountered a lot of physicians that are like, okay, you need to be on this medication. I'm not sure why you're not on it. How are you not taking this medication? I'm going to prescribe it and you need to take it, and I'll see you in 3 months. I mean, there's no collaboration between what I want, what I need, what I think would work, and that they're just throwing out all these orders. And so we need to kind of move away from that. And I'll tell you a story of one of my trips to the doctor. I have had significant head trauma as well. And so I will kind of, and with the anxiety, I'll glitch out and I'll get confused. I'll get mixed up very easily over simple things. I was supposed to turn on the water, hurry out, give it to the horses, and by the time I got out there, I forgot I even turned the water on. I forgot to give it to the horses. I mean, that was my whole point of going out there. And my brain just goes zzz. But I went to the wrong building. There's 2 McLaren buildings. I went to this one. I stood in line for 10 minutes with people in front of me. I get up to the window and I'm like, I'm here to see Dr. Weber. I have a 10:30 appointment. They're like, what? Dr. Weber's not in this building. And I'm just like, what? What do you mean? Well, Dr. Weber's over in the other McLaren building on Linden and Court. And I started crying. Because you know what I did? I screwed up. I made a mistake. I glitched out, went to the wrong building, and now I've made a mistake. In my mind, I've made a mistake. And what does making a mistake mean? You're going to get beat. That's what making a mistake to me is. And so I am driving 100 miles an hour like a madwoman to get over to my appointment, hysterically crying. I walk in and I get up to the receptionist and I said, I'm Morgan Scaven. I'm here to see Dr. Weber. I have a 10:30. Well, you're 15 minutes late. I don't know if we can see you anymore. Well, then it gets worse. Then I'm starting to really go into complete full-blown anxiety attack because I messed up. And she's like, let me just go check and see if they'll see you. I mean, she could see I was visibly upset. It wasn't like I was like, oh yeah, I stopped for coffee and I decided to have a bagel and I've been sitting out in the car for like 20 minutes and yeah, now I'm here for my appointment, so could you get me in? I mean, you can see I'm like hysterical. And she was so dismissive and so rude. And so trauma-informed care is also about teaching all staff, your front receptionist, your intake nurse, everybody has to understand what trauma looks like and what people coming in, are going to display. And so she finally gets me back, and the nurse is like, they're super upset with me. I'm crying. She's like, stand on the scale. And I'm like, I could barely stand. And by the time she got me in the room, and I was sitting there by myself, I just amped up even more, and I'm like hysterically crying to the point where when the doctor walked in, I'm like, I want to go home. And she's like, what? Why? You're here. What are you doing? What's wrong? What's wrong? I said, I was late. And she looked at me like I was nuts. What's wrong with you? What is wrong with you, lady? Instead of, what happened to you? Why are you this upset because you're late? I mean, they can make me sit there an hour, but if I'm 15 minutes later, you're bounced. And I was like, I went to the wrong building. I got confused. And she knows I have memory issues. She's like, it's okay. you're here now, we'll get this done, we'll get this taken care of. But instead of making my situation worse, they just, each step of the leg just kept, it's better, they kept making it worse. And so that's where we need really, really caring, nurturing, sensitive people at every leg of the step, you know, right from the front desk all the way through everything. And so hopefully I answered your question, but yes.
Yeah, and I think a couple of the other things that you're talking about, Morgan, are, which Dr. Dennis referred to too, are kind of these like opt-out opportunities. Like throughout Health and Human Services, we're going to have a certain amount of screening questionnaires or, you know, whatever that happens sometimes online, even before people arrive at their healthcare, Health and Human Services place, so that you can have like an opt-out, like, no, I don't want to have my blood pressure taken.
Oh, okay.
You know, I mean, or I'd be glad to talk to somebody about some of this history questions. You know, are you safe at home?
Yes.
You can kind of like click a button that says like, I don't want to answer that on an app. I want to talk to somebody about that. And so then it kind of like lets the healthcare provider know, like, okay, like they're willing to have a conversation about it, or maybe they're willing to have a piece of a conversation about it, but they don't want to answer those questions because that feels really impersonal.
It does.
And so that some people, like if you were upfront about whatever, about your history with alcohol and other drugs or with sexual abuse, I mean, it doesn't fit in this screening tool, right? Like you would be writing for paragraphs of your book.
Yes,
you know?
exactly.
Your second book with that, but you could say, like, I'm happy to talk to somebody, and sometimes even like signage that says, you know, if we're doing something that you don't like, or like, please let us know because we can figure it out.
Well, that's trauma-informed care. We're catching up.
Yeah, we'll figure it out. If you need to have the door open a crack, we'll figure out a way to make that happen. If you want to decline certain treatments, or if you're not going to take a medicine that your doctor is prescribing, just let us know because we will know that you don't want to take that medicine.
I'm very glad to hear that. I really feel like we're moving in that direction. It's taken a while, but I know we're going to catch up. We're going to figure this out, and we're going to help people be more collaborative with their physicians, no matter who it is, because that's the only way you're going to get good health care.
Just talking about healthcare, you were talking about how you didn't like being shut in. Well, I'm from Grand Rapids, and their doctor's offices have a curtain.
Okay.
Like, so you can just shut the curtain and leave the door open so you wouldn't be enclosed. And that's one of those little things that I wouldn't have thought about as being, but it's such a small thing. Like, it doesn't cost a lot of money to install a bar and a thing, but in situations like that, just like I think there needs to be a coding system for like sexual assault, because it can be triggering every time you go to the doctor and it says like past history, sexual assault at 16. It's like, trying to tuck that away. Like, I'm glad you guys know that, but I don't need to see it every single time I'm at the doctor's.
Right. Agree.
Like, it's noted, you guys know that, but I don't need to be reminded every time.
Right. And we're not going to get into a bashing of insurance companies, but a lot of this has come from them. A lot of these rules and regulations have come from them, and that's a problem because that's dehumanizing the whole entire process of what you should be at a doctor for.
I think for me the most important thing that you said is training from the beginning to the end, because realistically, like, online surveys are great, but when you go in and you talk to a receptionist that's just a naughty word to you, like, it hurts, especially anxious. And I've been in a situation nowhere near yours, but where I was anxious and I felt really uncomfortable, and the person was just making it worse and worse and worse. Like, just stop talking, please.
Please stop talking.
Oh God, stop talking to me. And I think that, like, we need to recognize that there needs to be more training, because unfortunately, the healthcare field, there isn't a passion with everybody. I may have a passion, but a lot of people are going into this field just for a paycheck, and that's not helpful when you are in a situation like yours or I, that you need somebody to genuinely walk you through the process, and they're not willing to do that.
Agree. Again, it's taking out the humanization of the whole entire experience and just doing check, 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 because the insurance company says now we have to check, check, check. And this has to be a rule, this has to be a rule, this has to be a rule. And those rules for people with trauma can just enhance that whole situation into the negative. So if you were to take my blood pressure, I'll say it's going to be extremely high, and no, I'm not going on blood pressure medications because my blood pressure is 170/80. You just totally went against what I feel safe with, and putting that cuff on and doing that to me, it's going to go through the roof. Or they do it right when you get there. I mean, let's at least start doing it when they've been sitting down and in the appointment for a while, and maybe the physician has made them feel safe and comfortable. Then let's take vitals, you know. Question? Okay. Oh, yes, ma'am.
I'm going back to the blood pressure. I kind of had a fight with the medical assistant because she wanted to take my weight, and I'm like, I was just here 2 weeks. Look at the chart. Like,
Right.
my weight didn't fluctuate that much in 2 weeks, and if it did, that's my problem. First of all, second of all, I have a boots coach
Yep.
jacket. It's not going to be accurate anyway.
Right.
She actually stood there and waited. I'm like, what are you waiting for? I'm not leaving.
I know.
Schedule appointment. Well, I need 2 vitals. I said, take respiration and heart rate.
Right.
It
Right.
doesn't have to be that particular
Right.
vital if they need to.
Right. Right.
But don't even need to touch you.
Mm-hmm.
For respiration.
Right. Right. And why do they fight you?
Why do they?
Why are they fighting us? Why are they like completely looking like I'm insane because I don't want my blood pressure taken? I know that's part of physical. I understand that. But it's terrifying to me, and I completely go into this level of anxiety that raises my blood pressure to an inaccurate number, because 2 hours from now it's going to be totally fine. And I'll go into the doctor, and that nurse is like, you know, asking questions that they do. Are you in any pain? No. I mean, yes, I'm in pain. You don't think I don't live with pain? Holy cow, I'm in horrible pain. But I'm like, no. It's like, why do I answer that? It's that hide, and be as, you know, least amount of information as I can possibly get away with giving, because I just have to hide all of these crazy things that make me look like I'm insane when I'm really not. I've just been horrifically traumatized. And so, you know, you don't always get the accurate information on an intake. Here, let's stick this little wooden stick in your mouth and say, yeah, no, that's not happening, because you're not putting something in my mouth and forcing that into my mouth. Nope. And that one I will absolutely refuse, because no, thank you. If I'm there because I have an issue with it, then I'll let you know and we'll work on it. But no, you're not going to stick a metal stick or wooden stick into my mouth and just almost gag me, because I'm sure you can imagine what that reminds me of. So one of the questions I wanted to ask were, or basically go over, is traumas that someone might come in with. So in your example, you were a very naughty patient. You were a very naughty patient, and she's going to let you know that. Instead of wondering or asking or respecting, just in your case, respecting that you don't want to get on the scale, knowing it's going to add 10 pounds, and let's face it, us women are like, wait, my phone's in my pocket, that's 3 pounds, I got to take that out. I mean, you know, why can't we be respectful of that? Instead of right there, you got labeled, and probably got a sticker on your chart, this is a difficult patient. And so we get labeled like this without even people asking why. And what other things might you see or pick up on from somebody coming in as a patient in any field that might indicate, hey, we better kind of go easy, ask delicate questions? What might you see from somebody? Because I don't wear a trauma sticker. So what might you see from people? Yeah, good one. Yes. Mm-hmm. Yes. What else? She said eye contact and body language. Absolutely.
I work with a lot of kids, so like if you come into a situation and the parent's like refusing to let their child answer, especially if they're old enough to answer, and they keep kind of like pushing them off to the side, that might be a warning that.
That's a red, yep, you've got another red flag. Yes, what else? Potentially, in your case, agitation, irritation, starting to get a little irritated, a little frustrated, starting to kind of have a little bit of a conflict. That shouldn't be the case at a doctor's appointment. You shouldn't be like butting heads with each other from either the person at the front desk or the intake nurse or the doctor. Yeah. Mm-hmm. Yep. Yep. Mm-hmm. Mm-hmm. Yep. Yes, absolutely. I have 1, 2, 3, 4, 5 wounds right now on my fingers. Yeah, I chew my skin and my fingernails right down to where they bleed. And yeah, that was very good.
In the summertime, it's hot.
Yes, they might be cutting. Yes. Yep. Some of the things that, just complete flat affect, just like no engagement. Well, why? You made the appointment. You're coming in. It's your physical. Why are you just like numb flat? Well, that's a very good indicator of post-traumatic stress. And so, so was my hysterical crying. It's like red flag. Disassociation. Once I reach a level of anxiety, see you later, folks. I'm out of here. Confusion. Well, when was your last period? I have to start thinking about what month it is right now, what day it is right now, what day of the week it is, and then try to figure it out from there. I'm like, just total mind fog is another really strong symptom of PTSD. Hyperarousal, like you said, fidgeting, the tapping, this and this. I'm terrible at that. I wear these handy dandy touch points. That's keeping me calm right now. They're a miracle. Pass them on to your patients. They're called touch points. Does anybody know what EMDR is? Have you heard that yet? It's eye movement desensitization and reprocessing for people with trauma. These are similar to that back and forth for the biofeedback of the brain. So because once my nervous system starts to misfire and elevate, I'm no good to anybody. And I'm very proud of myself right now. I can even stand here and talk to you because I've already taken a Xanax. I've already got my touch points on. And my partner said, don't forget to breathe. And I'm like, oh yeah, breathe, oh yeah, breathe. I hold my breath. I used to swim, and I can hold my breath a long time. And you can imagine what that does to my pulse ox. It's like, why is your pulse ox like this? Well, I haven't breathed in 3 minutes, but I'll start now. And so there's all sorts of little nuances that you can pick up on. There's also hypoarousal, where you just do not engage, and can be either one, and I just won't even answer your questions. It's just too much. I have to just kind of check out. And then people that are unwilling to participate in their care, that's also can be another, like, well, why? Why are you not participating in your care? Why can't we have a dialogue about this situation or, a problem that you're having? Like I said, going to the dentist, gynecologist, mammograms, it's hell. It's hell. And the lady technician's like, okay, I'm going to move your breast over here. And I'm just like, that kind of stuff. And we avoid it as trauma survivors. We avoid it. And then guess what happens? Oh, missed your breast cancer. Sorry, missed that one. Now you've got breast cancer because you haven't come in for your mammogram for 3 years. And so, we have to help people feel safe and secure in every leg of the healthcare system and just be completely trauma informed and go off of that. Any questions? Oh, yeah.
I struggle with when I have to go to a new doctor, knowing
and I still have to go in there and talk about everything that happened to me and kind of relive all of that, and it causes, you know, re-traumatization and flares up my PTSD, and it takes for me to recover from going through all of that. What is your advice for that? Well, how do you handle that when you're like, oh, my doctor's retiring, or oh, they're moving to another state and have to get this doctor?
Yeah.
And you're sitting there thinking, I gotta do this again. I gotta lay it all out again.
Yeah.
So, like, here, read it. Like, give them the book. Read the book. I'm telling you again.
Yeah.
You wanna know.
Yeah, if you want to know my history, here it is. Yeah. I like right now I'm not overly in love with my healthcare provider because of the and it's a hospital-based facility, and so boy, their rules and regulations are something else. Their whole outer staff from just the physician is a train wreck. And the last time I went there, I finally told her, I said, you know, everybody loves you, but everybody wants you to leave this blank hole because they're horrible. I mean, my last appointment, the lady called me and she said, yeah, you need that letter about your working ability, and we can't just have her write a letter. You got to come in. I'm like, okay, no problem. I'll come in. She's like, how about tomorrow at 7:45? I'm like, perfect. So I get there at 7:45. The nurse informs me that the staff didn't inform the doctor that they added me on, and she's at home, 45 minutes away, coming from Lake Fenton. I'm like, how's that? But I really needed this letter. So I'm just like, I'm just immediately, I got mad. I'm like, you know, I've been through this before with you guys, and the whole outer parameters of this facility, they're just a train wreck. If you need a prescription refill, good luck, because the message isn't getting from A to B to C, or if it is, it takes weeks, and that should not be the case. And so I love her, but I don't like the office. But to answer your question, you know, I now will fill out those questionnaires honestly, and I feel like they don't read them. I spent an hour filling out 15 pages for a new patient, and I'm pretty sure she didn't read it because now she's coming in and firing questions at me right away. And it's on the paper. It would have been much easier if she had read that. Yeah, go ahead. Yeah. Did he answer you?
They kind of took a step back, but
Mm-hmm.
enough is enough. Like you said, it's uncomfortable. That's the point of me sending you the records ahead of time.
Mm-hmm. Mm-hmm.
You don't have time to read them, then don't ask for the records.
Mm-hmm. Yes, and some of the ways that I handle it depends on what type of doctor I'm going to, but I just don't disclose it. Like, if you can't read my chart, or if you can't read what I, answered on your 15-page questionnaire, and you're not going to try to find out now, then forget it. If it doesn't directly pertain to my specific care at that very moment, then I'm just not going to go into my story. And when I went to this doctor, it took me probably a year before I even told her how bad my trauma was. Well, she probably could have been doing many, many things to help me if I had disclosed all that. But they don't make it easy on you when you come in to talk about your trauma. And that's the whole, trauma-informed. And re-traumatization is super common. I mean, you just heard 10 examples from me how re-traumatized I was at an appointment. And so to me, that speaks to the fact that this place has no clue about trauma when 90% of us have had it. I mean, that's a huge number. I don't want to go over, so make sure you tell me.
So since we are in time, let me say a couple of things. One, thank you so much, Morgan, so much.
You're welcome. Thank you.
To share and be so honest and be so raw with us, change the system. And that's what you can do. As you're moving into your field, you can help to change. You can make the system change.
Yes.
Because the system doesn't have to be what it is because you're in it. And you're in it to change it. So, having said that.
Okay, I do want to tell one more thing, but go ahead.
Okay, having said that, Morgan will be around. She is selling her book. There's more water, there's more food. Please take a picture.
Yeah, take dinner home for you.
I want to thank our interim dean, Dr. Jennifer Harrison, who is here. You want to say something?
No, just that I'm about 2/3 of the way through the book, Morgan, and
Oh.
really enjoying it. I'm hoping to get you to sign your copy. A copy.
I only charge $50 for signatures. I do want to share one other story from Borges. Bless their hearts. They're a Catholic hospital, right? When I attempted suicide during the trial of my perpetrator, I got to a point where I'm like, yeah, you're not putting me in a courtroom on a stand in front of this man. So I'm like, I'm out of here. So I did. I attempted suicide. It's in the book. My roommate at the time worked for Borges. And so when the ambulance got there, I was pretty much almost gone. And she said, take her to Borges, take her to Borges, take her to Borges, because she worked there. Wow. How do Catholics feel about suicide? Which has no business in healthcare, how you feel about anything from a religious aspect when a person is coming in who's just attempted suicide. Do you know what they did to me? First of all, I was unconscious and they had to revive me. But secondly, and they put a tube down my throat. I swallowed a whole bunch of Sinequan. They put a tube, which is what they needed to do, the whole charcoal bit. But when I finally kind of came around and came out of it, I've just got massive bright lights in my face, and I'm tied down. I am tied down to this bed. And the nurse came in when she realized I was awake, and she's like, oh, I see you woke up. Well, great. She's like, I don't know what you're thinking, but you just hurt a lot of people by doing this little stunt. And I had the tube down my throat still, and I'm still tied down, and I'm like thrashing around because now I've got something forced in my mouth, and now my hands are tied down, which was, part of my trauma. And she's like, you've got a lot of people out there who care about you. I have no idea why you think you would pull such a stunt like this, but you're lucky you weren't awake when that tube went down. We're coming in to take it out. So they come in to take it out, and it's not a pleasant experience. And when it came out, I said, please untie me, please. No, this is protocol. You just attempted suicide. You're going to be stayed tied down until we feel like it's safe. And my family, once they arrived, and they're trying to explain to Borges what I had been through and what I was going through with the trial and why I wanted, why I did this stupid thing, they're like, well, it's too bad. It's protocol. They're like, she was tied down and raped for years. Can we please take her arms out of these restraints? Nope. And so then they moved me up to another room, and the psychiatrist comes in. He's like, well, how'd this work out for you? I'm like, what? And he said, well, you're still here, so they found four or five pills left in the bottle. Why didn't you take those if you wanted to get out of here? And at this point, I have nothing to lose. And I basically told him to F off. And I said, because I would have puked, and then I would have really been in a shitty position, right? Because I would have just thrown them all back up. And he's like, and he left. And he said, well, I don't know what you've learned and why from this situation, but let me just tell you, this was a really bad mistake on your part. Like, I needed to be told that. And he said, what do you think you've learned from this experience? And I said, you know what I've learned? You can F off and get out. And he screeched his chair. This is a psychiatrist, you guys. This is somebody that's supposed to be helping me. And he just reamed me a new one because of their philosophy on suicide. Just that little tiny thing, that they were just so aggressive towards me because how dare you go against what our beliefs are. And that was probably one of my worst experiences in healthcare, was being treated like that after I had done that. Zero compassion, zero kindness, nothing. And it took my family 3 days to get me out of there, and I went back into a hospital that I had been in previous times, because the whole trial, which is in the book, just about put me over the edge. And so,
Am I able to ask what year this was?
yes, that was 91.
So I just want to clarify that that is antithetical to the current protocols at Borges Hospital, and it doesn't matter whether it's a Catholic hospital or a Methodist hospital, which Bronson was a Methodist hospital, that it is not protocol to put people in 4-point restraints after they've had a suicide attempt. It is not protocol to
So that's
blame people
changed.
for their suicide, or to ask them what they've learned from this. It is not that Borges Hospital does not think of suicide as a sin, thinks of it as a treatable mental health condition.
But as Dr. Dennis, told me, she said, we need to learn about the biases in healthcare. And back then, that was the situation, and those were extreme biases. Those should have been left at the door. As a nurse, she may be fully committed to the fact that committing suicide is a sin, and that is okay for her to be committed to that. But it's not okay for her to treat me that way just because I did something against her beliefs. And talk about re-traumatization. That was a big one. So thank you, you guys. If you have any more questions, thank you.
Thank you.
You're welcome, welcome, welcome.